Okay, thank you very much. So I'll make a presentation based on the USAID Action to HIV Epidemic Control project, which is implemented in Zambia. So I must mention that the aim of this project is to reduce HIV mortality, morbidity, and transmission of HIV by achieving the 95s, the 95 in 95. Apart from that, we're looking at improving HIV treatment coverage, providing comprehensive HIV prevention, care, and treatment. And this project is being implemented in the 3 provinces in Zambia. So among the key objectives of the project is integration of family planning into the 95% of HIV service delivery point. And there are a number of organizations implementing this project, Right to Care, Zambia being the prime, then Grassroots Soccer is among the sub-partners on this project. So on this slide, basically we are looking at the challenge that we have in terms of family planning in Zambia. So according to DHS 2018, it is clear that the contraceptive prevalence rate among the married women aged 15 to 49 is at 50%. And we have 20% of the currently married women who have unmet need for family planning. Then 60% of those who are currently married are not using contraceptive, but intend to use contraceptive in future. And on this project, the role for Grassroots Soccer is to create demand for adolescents and adolescent girls and young women to access family planning. So what is it that Grassroots Soccer Zambia has done on this project? So we see that Grassroots Soccer has trained young people we call coaches, the near peer mentors, whose age is from 18 years up to 35 years. And these young women or these young girls create demand in terms of family planning so that the AGYWs age 15 to 24 can access the service. So what was done is to employ a 3-pronged approach in terms of creating demand for AGYW access to family planning. The first approach that was used is ensuring that the coaches led community outreaches. So the coaches I'm referring to here, these are peer mentors who conduct community outreaches, targeting hotspots, door-to-door marketplaces with family planning messaging. And we see that this is done in collaboration with the service providers in the community. The other part that was done, the other strategy, was to ensure that the coaches are seconded to the various health facilities that we are supporting in Northern Province. And they do offer family planning messaging in the different health facility service delivery points. Last strategy that was used is to ensure that the coaches use the sport-based curriculum we call Skills Girl. So this curriculum targets the 15 to 19-year-olds, both in and out of school girls. So we can see from this slide that we saw an increase of 41% when we employed the 3-pronged demand creation strategy. But I must be quick to mention that stockouts of commodities could actually affect service delivery. What are the lessons learned? So what we learned is Skills Girl coaches, like I mentioned, these are young people who serve as role models in their community, are easily trusted and provide a link for adolescents and young people to access family planning at the health facilities and in the communities. Then the coaches' participation in family planning data review meeting was cardinal in strengthening collaboration with implementing partners, which resulted in the seamless provision of these services in the community. We also see that the Skills Girl curriculum that is being used really play a pivotal role in linking participants to accessing services, including family planning. Then the last but not the least lesson learned is using a complementary approach where coaches paired with service providers enabled the on-spot provision of services resulting in completed referrals. In conclusion, we see that implementing a diverse mix of community-based mobilization strategies combined with engaging behavioral education was critical in creating demand and motivating uptake of services by AGYW. The other aspect that we're looking at is community outreach, skills interventions, integration of family planning messaging within the facility delivery points was successful. Last but not the least, as reducing unintended pregnancies for AGYW would ultimately prevent adverse consequences of early childbearing. I must convey special thanks to Ministry of Health, USAID, Right to Care, the clients, and grassroots soccer coaches. Thank you very much.